before we left, we were going to leave to Ecuador, the Navajo Nation trip got canceled because like a policy change that they had. And so all the girls had to be reassigned to different places. And so the Ecuador group offered to take a couple extra girls, and the situation with my family had cleared up, so it ended up that I could go back. So I was so happy I got to come back and rejoin the group and have this experience abroad.
We have had people that have just wanted the free medicine, but the majority of people have wanted to learn and wanted that education and they want to be self-sufficient. They're not beggars, they want what we have to teach them, not just what we have to give them.
I don't know his name, or he's probably like around 6, 7 years old, but he asked me a ton of questions. It was a lot of fun to kind of answer them because they're really silly questions for us, but to him and his friends, they really have no idea about it. Like stuff like snow, traveling in airplanes, like how did you get here, how are you leaving here? It has been hard and hot, but it's been a lot of fun. And not only is it fun, but it makes you feel very blessed and very grateful for the things that you have back home in the States. And it also makes you feel grateful to just be a little part of helping them in their healthcare. And as far as healthcare goes, if they're not meeting those other priorities like having enough food for their kids, then healthcare kind of goes out the window.
But a lot of them are in pain because they cannot access that proper medical care. And so to me it's rewarding because it's a way of being able to bring much needed rest or relief to somebody who's been having issues for a while.
It was the point where I was told that we're not seeing anybody, no matter who they are, no matter what's wrong with them. We just don't have the supplies. And there was this very sweet girl coming in. She just said, "I'm hurting and I'm throwing up." And I said, "There's one thing I can do for you, maybe." I went and asked my professor if we had any more baby kits left, and we had one baby kit left. I gave that to her and her face just lit up. And it was kind of like she realized that she could do this. And even though she'd be a single mom, that it was possible.
But one thing I did notice was because during the height and weights, we had to take off our shoes. And so it was really humbling for me just to see all these little kids with like these shoes that they would probably hand me down, so they've worn for long periods of time, and they were just totally eaten up and chewed up, their socks. One little girl wouldn't even take off her shoes. She didn't want us to see her feet. And it's great that we have this opportunity to come to Ecuador and to help these. I